one of the things that Scott and I always talk about with the go-to guides is that we want people to really understand that this is the first in a series of go-to guides. We'll be producing more of these as time goes by in different areas of school-age stuttering therapy practice. Scott, what do you want to say about the series?
So much. Okay. So we started with this particular volume on getting started with stuttering therapy because it's critically important at the early stages of therapy, set the foundation for later success. But it really is only the beginning. There is so much more that we want to share about how to actually do the therapy on a day-to-day basis, the activities we use, the rationale for those activities, how we modify those activities. The next volume that we've already started and actually made some delightful progress on, the next volume is about the counseling skills that clinicians need to have in order to help kids overcome the burden that they may experience associated with stuttering. So this is, how do you prepare for desensitization and how do you do it? How do you prepare for something like self-disclosure and how do you do it? But it's all of the preparatory work that's necessary in order to be able to do these things that are so commonly done in therapy, but without the foundation. This is the foundation for all of the therapy, and then we're going to just go through the rest of the therapy process in a way that by the time we're done with this series, we will have covered every aspect that we want to cover of how we do stuttering therapy on a day-to-day basis.
Exactly. And so that begs the question, what do we do first? So if you don't have this yet, I want to let you know that Scott and I have decided that this is a fabulous resource from, beginning to end on the idea of referral, assessment, talking with parents and teachers and other caregivers, how to design therapy, how to write goals, how to do the therapy, how to document the therapy. That's what this very large, comprehensive school-age guide has. And what we are doing with the go-to guides and the series that will continue to just, happen as we, pour it out onto pages, is that in every part of the go-to guide, we are taking one aspect that is already in here, and then we're giving the activities, right? We're expanding on it. And every time you open, we'll talk about left page, right page in a minute, but every time you open to do an activity, there will be an SLP side that gets you up to date and gets, why are you doing what you are doing, so that this is evidence-based and that it's part of the overall therapy process. And then there will be the activity. And every time there's an SLP page, it will refer you back to the chapter in this book to get all of the information you need to make sure that it's not just some kind of program and you're throwing out a worksheet to a kiddo. You're really feeling like it's part of not a willy-nilly process, but part of a comprehensive process that you understand so that you can help others understand the rationale and the way to do the activity that makes it most successful.
Can I give an example of that right now?
Go for
I'm
it.
going to get so fancy, I'm going to switch over and show that here on the left-hand side of the go-to guide, I just opened up to a random page and I found the activity, what words do people use for stuttering? And see how it says, get ready? Read chapters 1, 2, and 5. And here's chapter 5 of the school-age book right behind it, which already has many therapy activities built right into it. But now there are more. This one happens to be what words do people use for stuttering? And here on the right-hand page is an activity that your students can do in the session. We talk about developing a stuttering vocabulary. Well, here is a guidance for you as the clinician about how to enact that, and then worksheet pages. Again, always referring back to the main document. So they're designed to be synergistic. The green one we'll have different colors for the next ones, but the green one so far, building on the gold one.
Yes, and so important. You know, we want you to know this is when we started the process of writing together, the first working title of this book was The Thinking Clinician's Guide to Stuttering Therapy, because we know that our colleagues tell us all the time that this isn't one of their most comfortable, where they don't feel as confident in this area, and they want to know better and do better and increase their comfortableness and their confidence. And so that was why we put this together, and now why we're doing what we're doing with the activity guides that go along with the school age guide. And the big thing to note is that this is not a program. Scott and I don't believe in programmed approaches, because that's just page 1, page 2, page 3, without actually understanding the rationale behind it. Oh, zip, it's still not a cookbook. And so we want everyone to know it's not a program, because we believe that our colleagues don't really need a program. We believe that given the information and understanding the verbal diversity of stuttering, that leads us to, when we know why we are doing what we are doing, then we know how, and we know when, and we know if. All of those questions that we have all the time that programs try to answer without the prerequisite, that's when everybody gets off kilter and nobody knows what to do next. And we want to make sure that our resources don't feed into that. So it's not a program, but it's an amazing comprehensive guide. I'm going to introduce something, and then Scott, I want you to take it away, because this is something that I think as a person who has been reading lots of resources over my career, I'm guilty of this as well, sort of opening the book and then just getting right to it. And I'm going to tell you, we spent months and months on the introductions for a reason. So please don't skip the introductions. Please don't skip why we did what we did and what it all means. We're telling you a little bit about that now, but the most important thing is that if you want to get the most out of this resource and any other of the resources that we're going to be putting out in this series, you want to know what some of the reasons that there's these wonderful little icons and all of the other aspects that we put into that Scott's going to talk about.
So let me just show you an example of that. Nina pointed out the little icons.
Yes.
Let me just show you that you'll see thematic icons throughout the book. Every activity in this guide and in the future go-to guides is coded by what aspect of stuttering it focuses on. Well, what do I mean by what aspect of stuttering does it focus on? If you follow us, you'll know that we talk a lot about the fact that stuttering is more than just stuttering. There's more to stuttering than just speech changes in therapy. Well, so we have mapped out all of this whole series of go-to guides, where this one focuses on foundations, but it's foundations for potential speech changes. It's foundations for attitudinal changes. It's foundations for educating people in the environment. It's foundations for reducing adverse impact. So it shows you what aspect of stuttering it's focusing on, so that if you, as the thinking clinician, are saying, boy, I've really got to be working on diminishing adverse impact for this student, you can come right to the go-to guide and see, oh, look, there's that icon. This is an impact-focused activity. So that's one of the things that's explained in the front matter. The other thing that's explained in the front matter is SMART prep. You know, these days you can go on the internet and you're going to see all sorts of easy, simplistic things to do, no prep, low prep, and I don't mean to criticize others, but that's just not our preference. Our preference is SMART prep. We want you to know why you're doing what you're doing, because that is what's going to guide you to be able to make changes in the therapy for each individual student. So you can, between these two things that I just shared, provide comprehensive and individualized therapy. And that carries all the way to, remember I mentioned the left-hand page is for the SLP. Well, every page has for each activity, even just a rapport building activity. What is the activity? Why do you do it? When do you do it? How do you do it? And then in particular, you'll find different kinds of special features for each activity, like how to adapt it for different populations or different ages, how to adjust based on a student's background, how to take a deeper dive for those students who are ready for that. All of those categories are explained in that front matter that Nina mentioned. So you don't want to miss reading that so that you'll know how to apply that in a session as each time you're working with a student.
Amazing, Scott, because this is what we would want someone to help us with in any other area that we weren't always sure about in order to provide the most effective and efficient outcomes and feel comfortable and confident of why we're doing what we're doing, so that when the student, the caregiver, the teacher asks, well, why are you working on that? We know, and we can explain it, and then feel comfortable knowing that that person that just asked us that question feels like they have an informed clinician that is working with this child. And that's where we want to go, always, because that just feels like great therapy to us, to the child, to the people around the child. It just feels like we're doing things for a reason, and the child is reaping the benefit of it. And so I want to piggyback on something Scott said. The adaptability is something we really worked hard on and will continue to work hard on, because we know that when you open up an activity, that doesn't mean, that every child is ready for exactly the way this is printed or exactly the way we explained it. That's why we have the prerequisites are listed. If you haven't done, if this is sort of failing, if the kid is looking at you funny, then go back and go to some earlier activities or go back to the school age guide and read a little more and find out what you thought the child had that maybe they never got, what the child got but doesn't remember, and or didn't understand when they got that in a previous therapy. Maybe they weren't ready to learn that. So it directs you back. It also directs you forward. Say you have an activity and this child is like, whoa, I want more. I'm ready for more, right? And so then there's the deeper dives, which are really fun. And there's homework, expansion activities that we talk about, because we know that change doesn't happen just in the therapy setting. It has to be systematically guided out of the therapy setting to the child's real life communication. And it has to be done along a hierarchy of difficulty and in different situations. And so we provide some ideas for that so that SLPs can feel like, okay, I'm not just doing this here, but the child is then taking it on the road, as we call it.
One of the things that people often struggle with is exactly how to introduce activities or ideas in therapy. Like, let's say you want to do an activity that has to do with learning about the speech production. Well, clinicians often say, I don't know how to get started. I don't know what words to use. Well, one of my favorite features, here I'm going to share it this way this time, is our sample dialogues, where we take a sample situation for a particular activity and a particular goal. Of course, there is still a left-hand page explaining that activity, that goal to the clinician, and then a sample dialogue of how to get that discussion started and where it might lead.
Thanks so much for joining.
Thank you, folks.